From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday, January 18th. I'm David Crabtree. Before we get into the latest stories, we'd like to ask a favor. We're trying to create a better understanding of what you, our listeners, want to hear in this podcast. We have a survey that will take you about 5 minutes to complete, and we would really appreciate it if you would do so. You can find it at WRAL.com/coronapod. Again, WRAL.com/coronapod, and we really appreciate it. Now, tomorrow, adults 65 and older will be able to register for vaccines in Wake County. If you don't get through immediately, don't worry. Just keep trying. I spoke with the county's pharmacy director about what you can expect. Even though the goal is for Wake County government as well as local hospitals to have everyone in this county vaccinated at some point, we do understand there is still some hesitancy among people, even healthcare workers. As a pharmacist, how do you address that?
Sure. So I think the best thing to do is education, right? Answering questions from people, fielding them, having FAQs on our website, being able to take the time to meet people where they are and sort of see what their hesitancies are and sort of address them. So if it's a side effect issue, if it's an injection site pain issue, let them know you can take some Tylenol and do normal counseling like every pharmacist is trained to do. So we fill a special role, and a little bit of time with a pharmacist goes a long way, but a little bit of time with any healthcare professional really gets people over the edge and helps change some of those mindsets.
You know, next Tuesday when the phone lines open that morning and the website opens, I know that you, as far as you know, you're prepared. You have a call center to work with you, yet something of this magnitude has not been tested yet for this area. Do you believe that you are prepared for the onslaught, the initial onslaught of calls you're going to get?
I do believe that we are prepared for that. We have tested the system ourselves internally. Obviously, to your point, we have not had to go live to the community at large. That's why it's important to stress that you do not need to be the first person to call us, and you do not need to keep calling over and over again, or you do not need to keep going to our website over and over again. So there's two ways to reach out to us. So either calling the 919-250-1515 or going to our wakegov.com/vaccine website. Both will take you to the same exact area to answer questions. Just one will be done over the phone, one will be done via your computer or mobile device. And then you'll be put into our wait list, and some logic will be applied to those questions, and depending on how you answered. And then we will reach out to you and tell you that is your time to reserve your spot and schedule an appointment, whether with us or one of our hospital partners. And then you will come here and get your vaccine. You won't be waiting in line. You won't be standing in the cold. Mm-hmm. You'll be guaranteed your dose when it's your time. And that's why some patience is required and some time is required to get through this.
One last thing, Dr. Wittes, after we get the final dose, and I'm fortunate that I'm now on a calendar in another county in about 10 days to get that first dose, but I have a 5-month-old grandson that I am just biting at the bit to see.
Right.
How long before I will safely be able to see him after I get the second dose?
So we are still encouraging everyone to follow the 3 W's. Wear your face mask, wash your hands, and wait. It's going to be a while before things sort of return back to normal and what we saw pre-COVID here. Getting vaccinated does not stop you from spreading the vaccine at this point. So that is why more studies and more research is needed to be proven to see that. So again, not only do we have to be patient about getting the vaccine, but also sort of returning life to normal. You don't build a magical shield around you, unfortunately, that has it shoot off. So it's we're all in this together, and we'll keep doing what's right to make sure we're all safe and sound.
Dr. Jason Wittes, we appreciate your insight and your time. You work as the Wake County Pharmacy Director. Good luck next week. You know we'll continue to follow this.
My pleasure. Thank you.
We have made it easy for you to get your questions answered. Our county-by-county vaccination guide is available right now on WRAL.com. For the North Carolina Coronavirus Podcast News Brief, I'm David Crabtree.